Greetings, cosmic explorers of history. It's your host from Factomania, ready to journey back in time, not to distant galaxies, but to the sands of ancient Egypt. We often marvel at their pyramids, their gods, their hieroglyphs. But what if I told you their medical prowess, particularly in an area as delicate as the human brain, was just as monumental? It's a story that challenges our perceptions of primitive civilizations and highlights a truly astonishing chapter in human ingenuity. Prepare yourselves, because some of these revelations are, frankly, mind-boggling. Wait, ancient Egyptians performed brain surgery over 4,000 years ago with no anesthesia as we know it. You won't believe what they were capable of. We're talking about a civilization that, thousands of years before modern medicine, dared to venture into the most complex organ known. So buckle up as we unearth 50 electrifying facts about ancient Egyptian brain surgery. We'll explore their tools, their knowledge, the very evidence etched into skulls that have survived millennia. This isn't just history. It's a testament to the enduring human quest to understand and heal. Let's dive deep into the medical mysteries of the Nile. Ancient Egyptians practiced trepanation, a daring procedure involving drilling holes into the skull. This was often to treat severe head injuries or what they perceived as mental illness. The Edwin Smith Papyrus, dating to 1700 BCE, is our oldest known surgical text. It meticulously details 48 cases focusing on head injuries and brain treatments. These ancient surgeons understood the link between specific brain injuries and resulting bodily dysfunctions, showcasing a surprisingly advanced anatomical knowledge for their time. It's truly remarkable. Chapter 4. Some ancient skulls bear clear evidence of successful healing around trepanation sites. This proves astonishingly that patients actually survived these ancient brain surgeries. Incredible, isn't it? Chapter 5. What tools did they use? Evidence points to bronze scalpels, sharp hooks, and sturdy chisels. These were the instruments of choice for their delicate skull surgeries. Chapter 6. To combat infection, a major risk, they cleverly used natural antiseptics. Honey, with its potent antibacterial properties, was a common application on surgical wounds. Sweet solution. Chapter 7. It's fascinating to realize that medical specialization existed even back then. Some Egyptian doctors dedicated their entire practice to head and brain injuries. They were, in a way, true pioneers in this emerging field of neurotrauma. Chapter 8. Often, ancient Egyptian priests doubled as physicians. Their medical practice was a really intriguing blend of empirical observation, rudimentary science, and deeply ingrained magical beliefs. It's quite amazing how they combined these elements in their healing practices. Chapter 9. Interestingly, Egyptians believed the brain, not the heart, was the control center for physical functions. This belief directly contradicted later Greek views, which championed the heart as the seat of intellect. It's a debate that highlights the evolving understanding of the human body across cultures. Chapter 10. Skulls found at burial sites sometimes show multiple trepanations. This suggests repeated or ongoing therapeutic brain surgeries. If you're amazed so far, don't forget to like the video. Chapter 11. Why drill holes? Surgeries were often performed to release evil spirits. These entities were believed to be the cause of mental illness, seizures, or persistent headaches. Chapter 12. Trepanned skulls often exhibit remarkably clean, even holes. This high level of precision suggests sophisticated techniques and a steady hand from these ancient surgeons. Impressive stuff. Chapter 13. The trepanations weren't uniform. Some were circular, others square, or even oval. The shape likely depended on the specific reason for surgery and the tool used. Chapter 14. For some procedures, they employed stone drills. These were likely used with sand and water as an abrasive to slowly and carefully grind through the bone. Chapter 15. How was pain managed? They used substances like opium, wine, or the mandrake root. These were the early rudimentary forms of anesthesia available to them. Post-surgery, surgeons used linen bandages. These weren't just plain cloth, they were often soaked in various herbs to dress wounds and promote healing. Very resourceful. These ancient physicians demonstrated keen diagnostic skills. They distinguished between brain injuries they deemed treatable and those considered beyond their capacity to mend, a grim reality. Their medical texts, like the Edwin Smith Papyrus, actually describe conditions such as brain swelling and fluid leaks from the skull. This shows detailed clinical observation. The word for brain appears, believe it or not, 8 times in the Edwin Smith Papyrus. This is quite rare for ancient writings, underscoring its specific focus on neuro-related conditions. It's fascinating to think about how advanced their understanding was, isn't it? To seal wounds, prevent excessive bleeding, and potentially kill infection, they employed cauterization. This involved using heated instruments, a practice that, well, continued for centuries. Ouch! It must have been quite the experience back then. Chapter 21. Some skulls show surgical marks without any signs of breakage or healing. This has led some to speculate these could be from post-mortem study or practice. It's intriguing to consider the possibilities of ancient medical exploration, isn't it? Egyptians, quite progressively, believed mental disorders could have physical causes, not solely spiritual ones. This opened the door for physical interventions like trepanation for such ailments. During some surgeries, brain fragments or bone chips were carefully removed. This was likely done to relieve dangerous intracranial pressure, a sophisticated concept for the time. It's believed they may have used animal brains for medical experiments and anatomical study. This would have provided valuable, albeit basic, insights into brain structure. A ranking system existed among surgeons, progressing from apprentice to master. This suggests a structured approach to medical training and the accumulation of surgical expertise. Specialized battlefield surgeons were trained to handle the severe head injuries common in warfare. Their skills were crucial for treating wounded soldiers from combat, truly front-line medicine. The Great Library of Alexandria likely preserved vast amounts of ancient medical knowledge. It's tantalizing to think it might have held even more neurosurgical scrolls now lost. Surgical internships, a cornerstone of modern medical training, were practiced at temple schools. Places like the House of Life served as centers for medical education. Trepanation wasn't just for trauma, it was also employed to treat chronic conditions like severe migraines, epilepsy, and what they termed madness or persistent behavioral issues. Ingeniously, they created 3-dimensional wooden skull models. These anatomical aids were used to teach surgical techniques to aspiring physicians, a very early form of simulation. In some rare cases, gold plates were inserted into the skull after surgery. This could have been for healing, structural support, or perhaps as a status symbol. Their scalpels weren't just simple bronze, they sometimes used copper, meticulously sharpened with hard materials like quartz and obsidian for a finer, more effective cutting edge. The mystical side was ever present. Priests often recited specific spells before and during operations, seeking divine protection and aid for both surgeon and patient. Ancient Egyptian medicine, including its surgical practices, profoundly influenced later civilizations. Greek, Roman, and Islamic medical traditions all bear traces of Egyptian knowledge. It's a lasting impact that resonates through history. Pharaohs naturally had personal surgeons. These highly skilled individuals were especially crucial for treating battle injuries sustained by the rulers in their military campaigns. It's fascinating to think about the expertise required in those times. Successful surgeons commanded great respect and enjoyed high social status within Egyptian society. Their life-saving skills were clearly valued, elevating their position among the people. It's quite remarkable how their contributions were recognized. Egyptian doctors often performed surgeries in specially prepared, sanitized and sacred rooms within temple precincts. This blended the medical procedure with a sense of ritual purity. Trepanation wasn't limited to adults. Marks have been found on children's skulls, indicating that these surgical interventions were sometimes performed to treat early life issues. Remarkably, women could and did become surgeons in ancient Egypt. Evidence suggests they practiced, especially within the framework of temple medical schools, breaking some ancient gender norms. Some preserved skulls show intriguing signs of what might be surgical implants or structural reinforcements. Beyond just simple hole drilling, they were truly experimenting with repairs. The practice of removing brain tissue during mummification, often through the nose, demonstrates a practical, albeit non-therapeutic familiarity with cranial anatomy and the brain itself. Diligent scribes meticulously recorded each operation. These records served as invaluable texts for teaching future generations of surgeons and for future reference. Knowledge preservation was key. Ancient Egyptian neuromedical knowledge also influenced other texts like the Ebers Papyrus. This famous medical document included various remedies and treatments with neuro-based understandings. During brain surgery, patients or surgeons might wear magic amulets. These were believed to channel healing energy and ward off malevolent influences during the perilous procedure. Sometimes the skull was opened not just to remove bone, but specifically to drain excess fluid. This could have been from injuries causing hematomas or infections. Ancient papyrus texts, they describe symptoms of paralysis and quite astutely link these symptoms to specific types of brain or spinal damage. It's fascinating, really, how these early medical texts show a diagnostic connection between injury and effect. Trepanation marks, interestingly enough, reveal that surgery wasn't just confined to one spot. It was, in fact, performed on both sides of the skull when deemed necessary. This practice indicates some pretty complex diagnostic assessments were at play back then. Some ancient Egyptians may have believed that brain surgery could potentially cure blindness or deafness, especially if these conditions were thought to result from head injuries. Modern archaeological findings confirm that these sophisticated brain surgeries were being performed in Egypt at least 2,000 years before Hippocrates, the famed Greek father of medicine. Ancient Egypt's brain surgery techniques, documented and evidenced in bone, remain one of the oldest, most compelling examples of neurosurgery in all of human history, truly pioneering. So there you have it, a glimpse into the astonishing world of ancient Egyptian neurosurgery. It's a field that pushes the boundaries of what we thought ancient civilizations were capable of. These weren't just pyramid builders. They were skull drilling, life-saving pioneers, working with tools and knowledge that for their time were nothing short of revolutionary. The Edwin Smith Papyrus isn't just a scroll. It's a window into a medical mind that was observing, diagnosing, and daring to intervene in the most complex organ. The sheer audacity to operate on the brain, the careful documentation, the evidence of survival, it all paints a picture of a medical tradition far more advanced than many of us realize. From using honey as an antiseptic to understanding the brain's control over the body, these practices laid foundational stones for millennia of medical advancement. It makes you wonder what other secrets the sands of time still hold. Who would have thought that 4,000 years ago, Egyptians were already opening skulls, saving lives, and writing it all down? If you enjoyed these mind-blowing facts, make sure to like this video, share it with your fellow history lovers, and subscribe for more ancient wonders revealed every week. This is Factomania, urging you to keep questioning, keep exploring, and keep being amazed by the universe of knowledge around us.